The UK's first official drug consumption room has been approved by authorities in Glasgow, where users can be supervised by trained health professionals. It's being backed by the Scottish Government, and it's an attempt to tackle the growing opioid crisis, which sees around 500 people injecting drugs in the city centre on a regular basis. Joining me now in the studio, former Metropolitan Police Detective Peter Bleksley. Good to have you here, Peter. And down the line is Meg Jones, Director of Services at the harm reduction charity Cranstorun. We'll start with you, Meg. Welcome to the programme. Now, this is a place, a facility where drug users will take illegal drugs, including heroin, including cocaine, under supervision, and therefore with some kind of sanction. So they won't be prosecuted for doing it. They're allowed to do it. That's what it's for. Can you explain if you think that's a good idea, and if you do, why you do?
Yeah, of course. Firstly, I suppose it's worth saying that this isn't really a new idea. These sorts of facilities have been in operation for well over 20 years in countries around the world, including Australia, Switzerland, other countries in Europe and North America, the US and Canada. And as you say, they are spaces in which people can go and use their drugs safely. It means that if they are to overdose, then someone is on hand to support them. But it's also about the wider support services. So often people who use drugs and are either rough sleeping or homeless, so they are therefore already using in public places. They're using in places which have very poor hygiene and can be a real issue for policing as well. So these have been proven in a number of countries around the world. So they're not radical. They're evidence-based. There's already been an unsanctioned overdose prevention centre in Glasgow as well that was run by Peter Crikant that proved the concept and proved that these will save lives.
Are the drugs provided free to the users?
No, so these spaces, overdose prevention centres, people bring their own drugs into these centres. And it just means that they are provided with clean injecting equipment, a clean space, really basic things like clean water. And that helps significantly with some of the things that we see day to day, which are heartbreaking, you know, wounds and people that unfortunately lose limbs and suffer horrendously with the kind of health consequences of using drugs in unsafe environments.
There's no doubt, Meg, that there will be people listening to you talking who are thinking, hang on a minute, this is illegal. How can a government sanction people breaking the law? You're saying come in and break the law safely. Come on, it's against the law, it's a crime. You can be arrested for this, you can be imprisoned for this, but actually you can come in here and do it, this illegal thing, and we'll help you do it. We'll make sure you've got clean water and a nice clean syringe and by all means come here and do it. And I think people will be confused, maybe outraged, but certainly confused by the message, because how can you have a message which is taking certain drugs is illegal and also come here, bring your illegal drugs and take them here? It would seem to be contradictory, wouldn't it?
Yeah, and you're absolutely right. We've had a message over the past 50 years since the Misuse of Drugs Act was introduced in the early 1970s, which is just say no, don't do drugs. And it hasn't worked. None of this has worked. So unfortunately, what we have seen is more people using heroin and crack cocaine and drugs like that than we have done previously. Scotland in particular has the worst drug-related deaths in Europe. And frankly, if we're not able to provide these spaces, then people will be using those drugs anyway. So what we need to do is have something that is evidence-based, that's pragmatic, that's practical, that supports people where they're at, and then allows us to engage with people on other issues that are going on for them. Trauma, mental health, lack of housing, all of those other issues that we would want to support people with. That's how we're gonna...
And the issue of helping them to come off drugs, helping them to fight their addiction, helping them to get clean, as it were, is that going to be part of it? Because if you're facilitating the drug taking with the clean syringes and the water and everything else to make it more hygienic and a less terrifying and potentially death-defying experience each time, then how are you helping stop it?
Yeah, so people are much more likely to engage in treatment, which is things like substitute medication, if you build up that trust and confidence in the services that are available. So absolutely, some of the evidence worldwide demonstrates that people will engage with treatment through these kind of facilities much more than they would if they didn't exist. And ultimately, um, people can't recover or they can't seek help if they are frankly dead because they're using drugs in really unsafe environments.
Let me bring Peter Bleksley into this. I've discussed drugs with you many times over the years. Some people might be surprised to know your views on drugs in general, but what are your thoughts about an actual facility which helps people who bring their illegal drugs to take them with a level of safety?
I welcome this. It is a tiny baby pigeon step in the right direction. And of course, to tackle the entire illegal drugs industry, the fourth biggest industry in the world, we need to take giant leaps. And unfortunately, they're very slow in coming. But the people that will use this facility are really sad, hapless, problematic drug users, many of whom would, in other circumstances, lose their lives. I think many of us will have gone into a multi-storey car park, found the revolting stench of urine,
Oh, yeah.
discarded needles, burnt pieces of aluminium foil and the such like. This may go some considerable way to reducing that in the East End of Glasgow, and that will be a good thing. I do understand the outrage of some that will say, as you clearly pointed out, taking drugs are illegal. But the fact of the matter is, with illegal drugs being the fourth biggest industry in the world, bigger than the textiles industry, and everybody in this building and probably watching are wearing clothes and may have curtains and carpets, this is how big the industry is. That to solve it, it's going to take courage. We have to rip it from the grasp of organised crime, and this is a minuscule step in the right direction towards that.
What will the police feel about this? Because obviously part of being a police officer is waging war on drugs and drug lords and those who sell drugs on the street and the young people who work for them and trying to find the suits and root them out. And they're the ones who are making the big money, who always seem to be invisible. But they're, a great deal of police time, energy and resources is spent trying to stamp out drugs in the drugs industry, isn't it? And then you have this official place set up where drug users can come with their heroin and take it. I wonder if there are going to be police officers who don't like it, who aren't comfortable with it.
Police Scotland have been very much a part of the consultation process which has got Glasgow to this point. They will not be hiding around street corners, leaping out and arresting people for possession of small personal amounts of heroin as they make their way either to or from this consumption room. And credit to Police Scotland for being a part of that consultation process. Many police officers will tell you entirely off the record that the war on drugs is a folly. It cannot be won. It will not be won. And that there is a desperate need for a new, fresh, even radical approach, the kind of which I would put forward. But I'm grateful for this very, very small concession to those of us who want to reduce the harm that drugs do. The middle classes will not be taking their kale and their quinoa and their champagne to this facility to consume as they snort industrial amounts of cocaine like so many millions of people do. But it's a small step in the right direction.
All right, people now will be intrigued and they'll want to know, in a couple of sentences, no more, because we're running out of time, Peter, what do you think should happen?
Legalise and regulate. Please, anybody, never separate those words. Legalise and regulate the entire illegal drugs industry. It will take courage, it will take time and effort, but the rewards will be vast as we rip it from that vice-like grip of criminals who want you to take more and more and more.